let it out. There we go. Let that out for me.
How does it feel now?
It's a little tension right here.
Stretch it out a little bit here. Good. There it is. Yes, ma'am.
Yes. Amazing.
That was a lot.
What I look forward to. Oh.
There we go. Yes, ma'am.
Wow. Okay, that was good. That was really good. Oh. Wow. Oh. Oh. Yes, Lord.
Hey guys, Dr. Clerge, a DMV chiropractor. I'm here today with Jasmine.
Yes.
Jasmine. Okay. I'm saying it correctly?
Yes.
Okay. All right. So, you've been to a chiropractor before, right?
Yes.
How did it go?
It was good. I don't think it was a thorough adjustment.
Okay.
So I decided to come here.
Okay.
And see what else I can do.
Okay. All right. And basically, from the history that we had, that we took, basically you told me that it was everything.
Yes.
Tension in the neck, upper back, lower back, and everything, right?
And I get headaches
Okay.
throughout the week. I don't know if it's from how I'm sitting at work, but the pain is, I guess, kind of elevating to give me headaches.
Okay.
So after I did go to my last session, the pain came back within the next day or two.
I see. Okay.
So,
And so you said when we talked that you're sitting, for an extended period of time.
Correct.
Watching different screens.
yes.
In the upper, lower back, how long would you say this has been going on?
For about 2 weeks now.
About 2 weeks, 2-3 weeks. Okay. All right. Any changes? Like weight gain, or maybe exercising, lifting anything heavy. Like anything different?
I believe I have gained a little weight.
Okay.
I'm not gonna lie, but
All right.
I started working. I'm not consistent with working out, but he did. The last chiropractor, he did advise that I do some more back exercises, maybe
Okay.
strengthen my back.
Okay.
And more arm work, I guess.
Okay, now that's good advice, because some chiropractors believe in the subluxation model and all that stuff. And other chiropractors, they actually believe in exercises and some adjustments to increase range of motion, that type of stuff. So based on what you're describing, he did give you good advice. Your session is going to be a little bit different because we're going to do exercises.
Okay.
We're going to stretch you out. We're going to do the adjustments, and then we're going to do the massage. Right?
Amazing.
So,
I love it.
yeah, with us, our sessions are individualized. So when you came in, you didn't see anybody waiting, things like that. We take our time, so we charge a little bit more because of the quality that we provide. But it's a little bit more extensive. Okay.
No complaints.
All right. We're actually going to start with the examination first. Okay. All right, Jasmine. So we're going to start with the neck. All right.
Okay.
And then we'll work our way down. Okay. So what I'm doing basically is checking your range of motion. All right. I want to see what type of movements you have.
Okay.
So we'll do kind of like a before and after.
Okay.
We'll see how you're moving first, and then after the adjustment of the treatment, see how you're moving afterwards. Okay.
Amazing.
All right. So I'm gonna have you do some lateral flexion, and you let me know how that feels.
Okay.
What do you feel with that, with what I'm doing?
A little tension.
A little tension?
Yeah.
Let's go to the other side. That's uncomfortable?
Same, but same tension. Just
Okay.
a lot of, it's like I haven't used that muscle in a while.
I hear you moaning a little bit, so I'm like, okay, all right. So let's have you rotate, and then I'll rotate you. So I'm gonna have you do this motion for me, like this, and then like that.
Okay.
Let's go to this side. All right. What do you feel with that?
No pain.
No pain?
No.
Okay. So now I'm going to do it for you,
Okay.
and then you let me know what you feel.
Okay.
That's okay or what?
That's good.
That's good?
That's good.
Okay. That's fine?
That's good.
I'm going to apply pressure.
Okay.
Is that okay what I'm doing?
That's good.
That's good? Pressure. Is that okay what I'm doing? Okay. Apply a little bit more pressure. That's okay?
That's good.
That's good. Okay. All right. So now we're going to check your lumbar range of motion, which is your lower back.
Okay.
We're going to see how far you go, you know, that type of stuff, okay?
Okay.
So let's have you stand up for me.
Okay.
All right. So I'm going to have you bend forward for me.
Okay.
And then you let me know what you feel. Let's see how far you go and, you know, what's going on when you do that.
Okay.
So let's have you kind of bend. Go as far as you can.
Ooh.
That's a bit uncomfortable.
A little bit.
Okay, where do you feel it?
Like here.
Okay, so hamstrings are tight.
And
lower back.
like right here.
Okay, gotcha. All right, let's have you come back up. Okay, good. All right, so now I'm going to have you extend. So what that means is that I'm going to have you go back. Okay, I'm going to go behind you and hold you just in case. All right?
Okay, because
Yeah.
my balance.
Right.
Okay.
Okay.
Should I do your hands up too?
Yeah, let's have both hands up.
Okay.
And let's have you go ahead and extend for me. And let me know when it starts to get uncomfortable.
That's all I got.
That's all you got.
That's all I
Okay. All right. What did you feel it?
All here.
All in the lower portion?
Yeah, like my tail. Well, this is considered your tailbone down here, so maybe like mid.
Okay,
here.
I see. Like lower lumbar. Okay.
Mm-hmm.
So let's have you face this way for me. All right. Now, I'm gonna have you put your arms up like this,
Okay.
and I'm gonna have you rotate. Okay, and then you let me know how it feels. But I'm gonna get behind you and hold your hips. That way you're not rotating your whole body. Okay.
Okay.
I just want you to focus. I want to focus mainly just in that lumbar region. Okay.
Got it.
All right. All right. So Jasmine, let's have you turn to the right for me here. Good. How's that?
That's good.
That's good?
Mm-hmm.
Let's have you turn to the other side
Okay.
slowly. That's a little bit uncomfortable. Oh, is that okay?
It's okay.
That's okay?
Mm-hmm.
All right. So same scenario, but this time it's going to have you go sideways. So right and then left, okay?
Okay.
You let me know if you feel any pain, tension, or anything like that, okay?
All right.
All right. Let's go to the right.
I'm good.
You're good. Let's go to the other side, to the left. Okay. You're good?
I'm good.
Okay, so you can put your arms down. So basically the issues you had was with the flexion and then the extension, right? Where you
Right.
felt it in the lower back and you also felt it in the hamstring area, right?
Yes, definitely
Okay.
hamstrings.
You can have a seat. So I'm gonna have you face down and then we're gonna assess the mid back and the lower back, okay?
Okay.
All right. So your face is gonna be right here.
Okay. Oh, okay.
And you can put your hands up. Okay. All right. So what I need you to do is I'm going to have you lift this whole leg off the table as far as you can get it, okay?
Okay.
And then you let me know what you feel, all right?
It's
You're
like
in,
right now I'm having a sharp pain, like in my back. It's crazy.
where, in mid-back or lower back?
Lower back.
Lower back.
Yeah, as soon as I lay down.
Okay.
Right there.
Right where I'm pressing.
Mm-hmm.
All right. Let's lift this whole leg up for me. And
Okay.
then let me know what's going on. You're going to keep it straight. So this
Okay.
leg is going to be straight, and you're just going to lift. Okay.
Oh, wow.
Yeah.
Okay.
How does that feel? Is that uncomfortable?
No, it's not.
That's not too bad?
Mm-mm.
How does your lower back feel with that? You can bring it down.
It's still there.
It's still there?
The pain, yeah.
Okay, so now let's have you do the same thing. Lift that leg up, all the way up for me.
Okay.
And let me know what you feel. Oh, okay. This one doesn't go as high. Okay, there we go. What do you feel? What's going on?
It's a little bit of a
A
struggle.
little bit of a struggle, which I've noticed. Okay, you can bring it down. So you're struggling more on the right side compared to this side, right?
Uh-huh.
Okay, so now we're going to do that again, but this time I'm going to apply pressure, okay, to your leg,
Okay.
and you're going to resist me, okay?
Okay.
All right. All right, so Jasmine, I'm going to have you lift that leg up for me again,
Okay.
and I'm going to apply pressure, resist. Don't let me push it down, resist. Is that uncomfortable?
Yeah.
Yes. Okay, bring the leg down.
Okay.
Good. Let's do the same thing on this side. Lift that leg up for me. And I'm going to push down. Resist. Don't let me push. Well, okay, that's uncomfortable?
Yes.
Yes. Okay, you can bring it down. All right, okay. Let's have you go ahead and... Well, actually, while you're there,
Okay.
I can assess your mid-back while you're here.
Okay.
All right. I'm going to apply pressure. And basically, I'm assessing, for like muscle tension, that type of stuff.
Mm-hmm.
And then you let me know what you feel with that, okay?
Okay.
All right.
Ooh.
That's uncomfortable?
No, it's just pressure.
Pressure?
Yes.
Yes. Okay. So with that type of palpation, you feel pressure, right?
Yes.
In the areas that I did. Okay. All right. Let's have you go ahead and sit up for me.
Okay.
All right. How you
It's
feel?
a little comfortable down there.
It's uncomfortable or comfortable?
No, it's comfortable down there.
Comfortable down there? Okay.
Yes.
All right. Okay. So I'll explain to you what I think is going on. Okay. And then after that, we'll start with stretches. And then I'll show you some exercises you can do.
Okay.
And then we'll do the adjustments. Okay.
Okay.
Okay. All right. So different things. You know, when you're at work, make sure that your desk is level. That way you're not doing this, okay?
Okay.
Because when you're in this position, it creates a lot of tension in the upper cervical area and even the mid cervicals, okay?
Okay.
So you want something that's a little bit level, all right? That's the first thing.
Okay.
You know, a lot of patients, they come to me with neck pain, back pain, you know. Chiropractic care does help. However, it's not a long-term solution. What I mean by that is you have to do some of the work as well. You know, what we do is we do the stretches, we do the exercises, we do the adjustments. It provides temporary relief, okay?
Yes.
You feel good, and then a few days later, you feel pain again, right? So part of it is you have to exercise to strengthen your muscle. Sometimes the muscle is too tight, you may have to stretch it, okay? So different things like that, I think, will be very beneficial for you, okay?
Okay.
The other thing is, let me have you stand up for me. So typically when, I've seen patients with a hyperlordotic curve, meaning that your curve is kind of like this, okay? It tends to create a lot of tension, in that lower portion, okay?
Yes.
That's something that I've seen, the course of my career,
Okay.
So weight loss helps, okay? All right, so we talked about, being in treatment on a consistent basis. And I say consistent, not, some chiropractors will have you come 3 times a week, maybe like once every 2 weeks.
Okay.
Until you get better, and then it could be like once a month and then once every 6 months,
That's reasonable.
So, that treatment, stretching, exercises are definitely very important, to strengthen the back, strengthen the upper region.
Okay.
And then weight loss is also
Key to
important.
everything.
Yeah, because, with a lot of pressure, stiffness, you're not able to move as much, it helps a whole lot.
Okay.
Any questions for me?
No.
No questions?
No questions.
Okay, have a seat. All right, so you don't have any questions, so now we're going to start with stretches and exercises, okay?
Okay.
And then after that, we'll do the adjustments, and then we'll do massage.
Sounds good.
Okay. All right, so now we're starting the stretches part of the whole thing, okay?
Okay.
So this is passive. So passive means that I'm doing it for you, okay?
Nice.
And so you don't have, no effort on your part. You just got to relax, take a deep breath, let it out, and just relax, okay?
Okay.
Now, the active part, that's where the exercise come in. Active means that you're doing it yourself. Okay, so you're recruiting muscles to strengthen the muscles to do it. So we're going to do 2 exercises that I'll show you for your back, because that's what your main concern is.
Yes.
And then we'll do a few other stretches for neck, upper, lower back, okay?
Sounds good.
All right, so I'm going to have you on your back. So you're going to be on the floor, you're going to be on your back.
Okay.
And I'm going to give you this to put behind your head. All right, so when we did your lumbar flexion, meaning when you went forward,
Yes.
your hamstrings were really tight, okay?
Yeah.
So then what we're going to do is we're going to stretch out your hamstrings first, okay?
Okay.
All right, and then Shaquan is going to also do some stretches with you as well, okay?
Okay.
All right, so this leg is going up,
Mhm.
and you should feel the tension like right here. When you start feeling it, you let me know, okay?
Okay, it's there.
It's there already? All right, so just relax for me.
Okay.
What I need you to do, though, is I need you to take a deep breath and then let it out. There you go. Good. And then we're going to bring that up a little bit and out. And now just relax. Good. Reason we're taking a deep breath, letting it out, is because most people tend to tense up when they're stretching.
Okay.
So we need you to take that deep breath, let it out, and then relax. That we can kind of push further, okay?
Okay.
All right. Deep breath. And go ahead and let it out. Perfect. Good. Okay. One more time for me. Deep breath. Go ahead and let it out. There you go. Good. What do you feel? What's going on? Tightness in the hamstrings?
Yeah, it's right here.
Yeah. Okay.
It's all right there.
All right. And we're going to let that one go. Good. Go ahead and take a deep breath for me. Go ahead and let it out. There you go. Good. Perfect. Nice. Okay, now we're going to do the other side. This leg is coming up. Need you to just relax for me.
Okay.
Deep breath. Let it out. Good. Is that too much for you?
At my limit right there.
Right there. All right, relax. Try and relax as much as you can.
Okay.
One more time. Deep breath. Go ahead and let it out. There you go. Good. Bring it down. All right. We're going to go again. Just relax that leg. Take a deep breath for me. Go ahead and let it out. There you go. It's tight?
It's tight.
It's tight. Okay, that's cool. That's cool. We got you. One more time. Deep breath. Go ahead and let that out for me. Good. Okay. We'll do it one more time. Leg. Go. Deep breath. Go ahead and let that out for me. There we go. Nice. Good. Okay, perfect. All right. The other one we're going to do is going to be mainly focused on that lower back, okay? But it'll get a little bit of that piriformis area as well, okay?
Sounds good.
So, what I want you to do, this leg is coming up. Good. You can actually put your hands, you can interlock and put them in the belly.
Okay.
And we're going this way.
Oh.
Yeah. Go ahead and take a deep breath. Let it out. Where do you feel it? In this piriformis area?
Yes.
Okay, gotcha. Okay. All right. Go ahead and take a deep breath for me, Jasmine. Go ahead and let it out. There we go. Nice. I'm going to go a little bit further this time.
Okay.
That's tight?
Feels good.
Feels good?
Feels good.
Okay. One more time for me. Deep breath. Go ahead and let it out. There we go. Good. Perfect. Let's go to the other side. We're going to do the same thing. All right. Let's take this up.
Okay.
Good. I want you to just relax for me. Go ahead and take a deep breath. And go ahead and let it out. Good. How did that feel?
It's good.
It's good? Let's go ahead and take a deep breath for me here. Let's go ahead and let that out. There we go. Nice. Good. I feel you're resisting a little bit. It's a little tight?
It's a little tight.
All right, one last time. Go ahead and take a deep breath. Go ahead and let that out for me. There we go. Nice. Okay. All right. Perfect. Okay. So now Shaquan is going to go ahead and do some more stretches with you.
Okay.
And then after that, I'm going to show you 2 exercises that you need to do. Okay?
Okay.
All right. Let me help you up. There we go.
Thank you.
All right. So what you're gonna do is you're gonna put one hand on your hip,
Okay.
one hand on the ear,
Uh-huh.
and you're gonna turn your body just like that. How does it feel?
Feels good.
How does it feel now?
It's a little tension right here.
All
This
right.
area.
So you're gonna do the same thing on this side a little bit. How does that feel?
Feels good.
Do you feel the stretch?
I do.
Breathe in. Breathe out. All right.
And I could do these at home. Yes, these are good.
Breathe in. And release. What you're gonna do is you're gonna bring both legs up.
Okay.
Breathe in. Breathe out. How does that feel?
Good.
Can I go further?
Yes.
Breathe in. And release. How was that?
This is good.
I'm just gonna hold for just a minute.
Okay.
Alright, we're gonna bring it back down. Relax. And release. How did that feel?
This is good.
Alright. Breathe in. And let it out. How was that?
This is good.
That's good. Okay. So what I'm gonna do is I'm gonna apply a little bit more pressure.
Okay.
Breathe in. And let it out. How was that?
This is good. You can go a little harder.
All right. Breathe in. And let it out. All right. You're going to bring it down.
Mm-hmm.
Breathe in. And release. How did that feel?
Right here's good.
That's good?
Mm-hmm.
All right. And keep this leg straight, okay?
Okay.
Breathe in. And let it out. How did that feel?
This is okay.
Can I go further?
Mm-mm.
All right. Breathe in. And release. How did that feel?
This is okay. Mm-hmm.
Breathe in. And let it out. How did that feel?
This is good.
All right. And bring it back down. And let it out. How was that?
Feels good.
Breathe in. And release. How was that?
It gets better each time.
I see.
It gets better.
Breathe in. And let it out. How did that feel?
This one's good.
Very good. Breathe in. And let it out. Can I go further?
Mm-hmm.
Breathe in. And release. How was that?
This is good.
Breathe in. And release. How was that?
This is good.
That's good? Okay.
Mhm.
We're going to bring it down. Breathe in. And let it out. How was that?
This is good.
All right. We're going to do this one more time, okay?
Mm-hmm.
Breathe in. And let it out. How was that?
This is good.
I'm going to go a little further, okay?
Okay.
Breathe in. And release.
So we're going to be stretching the neck area, okay?
Okay.
So I just want you to just relax and just don't resist, okay?
Okay.
All right. So I'm going to go underneath your hair and you can just drop your head. Good. All right. So I'm going to start this way. Go ahead and take a deep breath for me. Go ahead and let it out. Good, 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 good. All right. I'm going to let it back. Deep breath. Go ahead and let it out for me. There you go. Nice. Good. Is that a bit uncomfortable?
It's different.
It's different. It's a little tight, right?
Yes.
Okay. Let's do it one last time. Deep breath.
Mm-hmm.
Go ahead and let it out. There you go. Nice. Good. And then this time we're just gonna let's let your head go. I got you.
Mm-hmm.
And we're just gonna kind of like stretch it out a little bit here. Good. Good. Go ahead and take a deep breath for me. And go ahead and let that out. There you go. Nice, 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 nice. Perfect. Good. Okay. And now we're going to go to the other side. You're going to lift the head up for me there a little bit. There we go. Good. Just drop it down. Good. Relax. Deep breath. Go ahead and let it out. There you go. Good. One time. Deep breath. Go ahead and let it out. Nice, nice. Good. We're going to do it one last time. Deep breath. Go ahead and let it out for me. There you go. Nice. Good. Breath. And go ahead and let it out for me. There we go. Nice. Okay. And one more time, we're gonna lift. Just let your head down and just relax.
Okay.
All right, relax. There we go. Nice. Great. Okay, and we can bring it down. Perfect. Okay, let's just sit up.
Okay.
Set this up for you.
I'm so relaxed.
Feel relaxed, right? Yeah, yeah.
I haven't felt like this. Wow.
All right. So So now those were the stretches, and the goal of the stretching is to kind of like decrease stiffness, increase your overall range of motion.
Okay.
Now the exercises, which is very important, is for strengthening that lower back, where we're going to focus on. Okay.
Right.
So we're going to do 2, and I really think you should do them very often. Okay.
Okay.
So basically, with this motion, with this exercise, 2 motions. The first one, you're going to bring your head down. I'm going to do it first and I'll show you how to do it.
Okay.
You bring your head down and your upper back is going upward. Okay?
Okay.
So it's kind of like this motion.
Okay.
And then the opposite motion afterwards. Your head will go up and you're going to let your upper back go downward. Okay?
Okay.
So, alright. So let's go ahead and try it.
Okay.
So the head is going to go down. And we'll bring this, call this the cat camel. You know when a cat's ready to fight and then they take that position?
Yes.
Okay. All right. Good. And then you're going downward. Head is going up. There you go. Perfect. Good. Body's going here. Good. There we go. And then the other way around. There we go. Nice. Perfect. Good. Okay. Alright, so the next one we're doing is pretty simple. So the whole body goes downward like this.
Okay.
And you're just going to push yourself upward this way. Good. To the point of comfort. So if right here is where you're comfortable, you can stay there.
Okay.
If you can go a little bit higher, you can do that. So as you continue to do these exercises, you get better at it.
Okay.
And then you can actually go farther. Okay?
Okay.
Alright, so let's go ahead and try it. Good.
And you said push up.
Then you're going to push up.
Okay.
Go ahead. Good. Very nice. Perfect. Good. Let's go ahead and go back down. We're going to try it again. Jasmine, so now we're going to do the popping and cracking. The proper term for it is adjustment, okay?
Okay.
The goal of the adjustment is to kind of help increase that range of motion,
Okay.
decrease the stiffness that you're having, okay? It doesn't align, you know, people call it alignment. In a sense, it doesn't necessarily align, okay?
Mm-hmm.
It's more so the range of motion of the joint that it helps, okay?
Okay.
All right, and your lower back, basically, when you were going forward into flexion, it was a bit uncomfortable. When you went into extension, it was uncomfortable. So we'll have you do these movements again and see how that goes, okay?
Okay.
All right, I'm going to have you on your side. You're going to be on your side facing this wall for me. Perfect. And I'm going to square your shoulder up.
Okay.
There we go. Good. All right, so you're going to cross your arm like this. Now, if your back is very tight, you may hear some popping and you may not. It all depends, okay?
Okay.
I'm going to go ahead and fix your lumbars a little bit. Good. So I'm going to bring your hip inward a little bit, okay?
Okay.
All right, so this way. Good. There we go. Good. All right. I'm going to reach in right here. So I need you to hold on.
Hold on tight.
Yeah, hold on tight.
Okay.
Good. So hold on to that arm like this. There we go. Good. I'm going to bend this leg like that. What I need you to do is just relax, okay? All right, I'm gonna do some motion just to kind of see what we're working with. Okay, let's see. All right, so hold on to this part.
Okay.
I'm gonna reach in like this.
Okay.
Good. Good. Deep breath. Let it out. There it is. Yes, ma'am.
Yes. I love it. I love it.
How was it?
Amazing.
That was a lot.
What I look forward to.
Yeah, you're right. Because you're like, when are we going to start popping and cracking, right?
That's the best part.
Yeah. Well, it's the best part, but the important part is you have to do the exercises.
Of
okay?
course. I felt it working up during the exercise.
But the adjustment, because it's instant relief, it just makes you feel better.
It does.
But you got to maintain with exercises, all right?
I wonder if there's some way you can do these at home. Like, do you recommend like twisting, turning to kind of bring that relief? I
most chiropractors are against you trying to self-adjust because we don't want you to hurt yourself, okay?
Okay.
Now, with the lower lumbars, I know I have patients, they say, doc, I come in and I do this, and it pops, it feels good. Have at it. I have no problem with that. Okay. But I do tell people when it comes to the neck, because some people, they'll do this, and I tell them not to do that because you have the, vertebral basilar artery there, and if things happen, it can create some problems, okay? So if you can do it yourself, have at it. But the neck part is just kind of like,
I'll leave that to
you. Yeah, leave that to professionals. All right, let's have you on the other side.
Okay.
You already got the position. You got the position down. All right, so I'm gonna go ahead and fix your hip, okay?
Okay.
There we go. Good. All right. I'm gonna reach in like this here.
Okay.
Hold on to this. There we go. Good. This leg I'm touching, make it straight.
Okay.
And we're going to bend this leg. Good.
Okay.
Now I'm going to do some motions here, just to kind of see what we're working with.
Mhm.
So. Good. All right. Good. Deep breath. Out.
Ooh.
Yes.
Oh my
man.
Gosh. That's amazing. Oh, yes. I love it. Woo. I feel it. So when you are feeling, what do you feel for to know
what to do?
Exactly.
All right. So different chiropractors, have different approach,
Okay.
But with me, what I'm searching for is lack of motion. Okay. So for instance, when I first put you in that position, I did some motion to kind of see where your resistance is. Okay. At that point in my mind, I'm thinking, okay, this is where she's locked up. Okay. We need to open that up a little bit. Okay. Because the more motion you have, the better range you have, less injuries and things like that, things of that nature. Okay. So I'm looking for a lot. So restriction is the word, So that's what I'm looking for. Where are you restricted? What type of force I need to apply, and that type of stuff.
Okay.
Okay.
Sounds good.
All right. So how was it, though? Not too bad?
It was amazing. 10 out of 10.
Let's have you come up.
Okay.
Okay. All right. I'm gonna have you face this way for me.
Okay.
All right. And I am going to do 3 more adjustments. Okay. 2 for the neck and then 1 for the upper back. Okay. Now, this upper back adjustment, you may not hear a lot of popping. It depends on how tight things are. You probably will. It depends. Okay. If it's super tight, typically you won't hear anything. But if it's restricted, then you'll hear a lot. Okay? Okay. I'm going to have you stand up for me. I'm going to have you lift both arms up. And I'm going to go underneath like this. All right. So you're going to interlock your fingers, put it on top of my hands, but go underneath your hair. There you go. Good. Perfect. Good. All right.
Interlock my fingers?
Yeah, you got it right. Yeah, and then interlock your fingers. There we go. Good. All right. You're going to squeeze your elbows. I'm going to bring you back. Okay. Squeeze them as hard as you can for me. Squeeze, squeeze, squeeze. Oh! There we go. Yes, man.
Wow. Okay, that was good. That was really good.
Not too bad?
Not too bad.
All right. Let's have you on the table. Let's have you sit for me.
Okay.
All right. So we'll do 2 more.
Okay.
This one's going to be for the neck area, so the upper cervical, okay? So I'm focusing mainly this portion here and then up top, all right? Okay. Okay. So for this one, you have to be as relaxed as possible. When I tell you to let everything go, just let everything go, okay?
Okay, everything is gone.
All right. So I'm going to reach around. Good. What I want you to do is just kind of like drop your head in the palm of my hand. Good. All right. And just relax. Okay. Drop your shoulder, drop your head a little more. You're tensing up. Let's count to 3. 1.
Oh! Wow. What happened to 3? Woo! Wow.
Not too bad.
That took me 4. I went to heaven and came back. That's what it was. Okay.
Not bad.
That's not bad.
How did it feel?
Amazing. Amazing. You did not count to 3. I was
Well, what happens is that people tense up, right?
Okay.
So when I told you to relax, most people they do the opposite.
They tense.
So I said relax, and you're anticipating that I'm about to pop your neck. You know, it's your neck. You know what I mean? Mm-hmm. So you started to tense up. So I knew when I got to 3, instead of you relaxing, it's gonna be, it's coming. So we had to get you before 3.
That was good. That was really good.
All right. So my 3 trick is not gonna work anymore, obviously. All right. So same scenario. All right. So same scenario. Good. Gonna have you kind of like rotate. Good. Just drop it in the palm of my hand. Need you to relax a little bit more for me there. Good. We're gonna drop it.
Oh. Oh. Yes, Lord. Thank you. God sent. God sent. Oh, that's different. That's really different.
How was it?
Amazing. I'm on cloud 9.
How do you feel now, though?
Lighter.
Lighter.
I feel lighter, and I feel like I'm more limber. And it's just immaculate. It was good. It's beyond.
How was it? Did you get those type of adjustments the other place too? Or similar?
It was similar, but he had me laying this way, like on my stomach. I don't feel like it was that intense. Okay. But I got a more better feeling this time than the last time.
Okay. But the good thing is, it both visits went well.
Yes.
The other chiropractor, like I mentioned, it seemed as if he knew what he was talking about. He talked about exercises and the adjustments and stuff like that.
Yes.
So, yeah. All right. So let's have you come up and let's do those ranges of motion again. Let's see how things go now.
Okay.
Let's have you stand up. The first one we're going to do is the extension, right?
Okay.
Because when you did it, you were like, as soon as you got there, it was uncomfortable.
Okay.
So let's put both arms up. Let's go ahead and let you go back. Okay. That's not bad. There you go. Good. Okay.
I feel much better.
Feel much better?
I do.
Let's have you go forward. Let's see how far you go now.
Okay.
Oh, there you go. You touching your toes?
I'm touching toes.
Nice. Let's have you come back up. All right. Let's have you kind of rotate right and left. Let's see what happens with that. That's not too bad?
It's not bad.
Not bad at all?
I heard a little crack, but that's the after effects.
All right, so then now we're going to do the massages, okay?
Okay.
So we're going to focus on the muscle. So Shaquan is going to take over. She's going to massage here, here, and then here, okay?
Okay.
All right, perfect.
Thank you.
You got it.
You're amazing.
Breathe in. Breathe out. You okay?
I'm half asleep, child.
How did that feel? How did that feel? Is your arms comfortable like this?
Mm-hmm.
How did that feel?
That's good.
Breathing contraction. This is your last part. So what I'm gonna have you do is I'm gonna have you lay up on the table.
Okay.
Facing up. You can leave your shoes on if you want, if you feel comfortable, or you can take them off. It's up to you.
I'll take them off.
You might want to scoot up a little bit.
Okay.
Make sure your head is in the pillow. Do you feel the heat? Is it
Yes.
too hot?
No, it's not.
Alright. Put your legs up, please. How do you feel?
Like a little vacation.
Alright. That's how we want you to feel.
Ooh, wow.
How did that feel?
Amazing. Wow. I didn't know tables could do this.
So you've had the stretches, you did the exercises, you got adjusted. A lot of popping.
A lot.
And you got the massage.
Yes.
And now we're doing the intersegmental traction table.
Okay.
So how do you feel overall?
I feel so relaxed. I feel at ease. And this is just like an icing on the cake. Right here. Like, this is amazing.
Not too bad, huh?
Not bad at all.
All right. Okay. Well, I guess we'll see you on your next appointment.
Thank you.